Hi, Dr. Mark here again from Newnham Family Dental. Here today, I have my associate, Dr. Tiffany.
Hey guys!
So today we'll be helping to debunk some of the dental myths. So we have our first question. Brushing harder and longer makes your teeth cleaner.
Oh, this one is quite a common myth. So brushing harder and longer does not make your teeth any cleaner. It's actually all about your technique. If you brush really long but have the improper technique, then your teeth don't actually become clean. So the way that we recommend brushing your teeth is actually by angling your toothbrush about 45 degrees towards your gum line and use gentle small circular motions to cleanse your teeth and your gums. And you do this all across all of your teeth, up the front surface as well as the tongue surface as well. And on the chewing surface, you can just do a scrubbing back and forth motion. Brushing your teeth shouldn't actually take that long. It should take on average about 2 to 3 minutes. Any longer than that, it isn't very helpful. Any shorter than that, you're probably not doing a good job.
By brushing too long, it can also cause extra wear to your teeth as well and can lead to more sensitivity.
In terms of brushing harder, we actually recommend you using a soft bristled toothbrush. We don't want you using a medium or hard toothbrush because that can be quite abrasive and damaging to your teeth and your gums. So to brush your teeth, you actually don't need to put that much pressure. You can just gently brush with a soft toothbrush. Electric toothbrushes are better than regular toothbrushes.
So normally I would just recommend saying that actually they work very similarly. So it's all about covering every surface of your teeth there. As soon as you cover all the surface and you do the right motion, then it actually does very similar things. But normally we do recommend for children, electric toothbrush tends to do a better job because they may not actually brush correctly.
And they're also really good for patients who may have suffer from a limited manual dexterity. For example, elderly patients who have trouble holding things or people with certain disabilities. Having an electric toothbrush can be an added bonus to help them improve their brushing.
Sugar causes cavities.
That's partially correct. Sugar is just one of the numerous factors that causes cavities. So how a cavity forms is if sugar or a carbohydrate gets left on your teeth for too long, the bacteria in your mouth actually starts to attach onto the sugar that's on your teeth. And over time, bacteria keeps building up, and eventually it uses the sugar or the carb as fuel and it eats it up and produces acids. And these acids will dissolve your teeth away, and that's how a cavity is formed. To minimize your risk of getting cavities in the future, definitely if you can decrease the amount of sugar and carbohydrates that you eat, as well as making sure that you're brushing regularly to disturb the bacteria buildup on your teeth, those will be the main ways to prevent cavities.
And it's also very important that after having sugar, if you cannot brush your teeth in a very short amount of time, you can always rinse your mouth with a bit of water just to help dilute the amount of acid in your mouth there.
Next myth. Fillings last forever.
So generally we say that fillings last anywhere from 3 to 10 years, depending on how you use it.
So for someone who doesn't brush and floss really well, you can actually get this thing called secondary decay. That's when you get a new cavity underneath the filling that you've already had done. And in cases like this, you will have to get your filling replaced. So remember to brush and floss, guys.
Baby teeth aren't important.
Oh, this one, a lot of our parents who come in with their kids, they ask us, oh, why do you have to fix this cavity on my kid if the tooth is gonna fall off anyway? First reason being is that baby teeth actually act as a natural space maintenance for the adult teeth. So if you think about it, when the baby teeth is in your child's mouth, the adult teeth is still down underneath the gums, and the baby teeth are there to preserve the space. If the baby teeth gets pulled out too early, what can happen is the teeth around where the baby tooth was removed can start to tip in, and it can block the adult tooth from coming in.
Generally, if you get your baby teeth taken out too early, it can lead to a lot more crowding in your child's teeth, and it makes braces in the future much more difficult.
You must get wisdom teeth removed.
For me, I think in general, you get your wisdom teeth removed if it is causing you pain or swelling around the area.
Other reasons might be if the wisdom teeth are impacting, say for example onto the tooth in front, then we may want to get them removed. But you don't always have to get them removed. So say for example, if your wisdom teeth came out straight, you're good at brushing, there's no decay or cavities, then yeah, it's perfectly fine to just leave them alone, just keep on brushing.
So there's actually a nerve along your jawline here that's close to the lower wisdom teeth. If your lower wisdom teeth is fully submerged and way too close to the nerve there, and there's a risk of nerve damage, generally we do recommend leaving it as long as it's not causing you any troubles. So normally in our consultation with you, we'll let you know, and then you can make the decision for yourself. Drinking apple cider vinegar helps to whiten teeth.
People think it's a natural way of whitening your teeth, and it is completely false. Drinking apple cider vinegar is actually very harmful. It's full of acids, and if you do it regularly and for long enough, the acids will actually start to erode or dissolve your teeth. It makes your teeth thinner, more brittle, and more sensitive. If you want to whiten your teeth, just come on in to see your dentist and we can whiten your teeth professionally and safely for you.
If you'd like to know more about whitening, please check out our other teeth whitening videos and it will give you more information.
Hydrogen peroxide and baking soda based toothpaste cleans the teeth well.
So basically, hydrogen peroxide is the main ingredient in whitening products. However, it's not the main ingredient to clean your teeth. For baking soda-based toothpaste, it actually has a more abrasive texture. In a way, it does help rub off the stains on your teeth, but in turn, it actually also causes more wear and erosion for your teeth there.
So what we say is for your regular everyday toothpaste, please just use a normal fluoride toothpaste. And if you're wanting to do any teeth whitening, once again, just do it with your dentist.
You are too old for braces.
Oh, you're never too old for braces. In fact, nowadays, I think both Dr. Mark and I can agree that we're getting more adult patients coming in requesting braces because they never got to do it as a child, or the teeth have moved since they got their braces done. Braces in adults and kids or teenagers is actually exactly the same. We use the same techniques and the same materials to do it.
However, braces does take a little bit longer the more mature you are, but the result still will be very similar. If you enjoy the content, please like and subscribe to our videos. And if you got any questions or any myth you would like to know, please comment down below. We'll be happy to answer all your questions. Thank you for watching this video, and thank you, Dr. Tiffany.
No worries. Thanks for having me, guys.